Hello everyone, I am Dr. Chinna Babu Sunkavalli, robotic surgical oncologist and founder CEO of Grace Cancer Foundation. Let's talk about women cancers in India. As you all know, the leading causes of cancer in women are in the site of breast, followed by cervical, and the third most common is ovarian cancer and then head and neck cancers. How do you detect breast cancer early? There are three simple methods to screen or detect breast cancer very early. Number one, if you are above the age of 20 years, be aware of your breast. Monthly self-examination or self-awareness of your breast is an important step in order to detect the breast cancer very early. So you may look at the online information about the breast self-awareness or examination, the various ways in which you can be conscious and aware of changes in your breast. That's number one. So any woman above 20 years of age can do a monthly self-breast examination. For those who have gone through the menopause, they can do on a fixed day, and those who are having a regular menstrual cycles can do a self-examination about 3 to 5 days after the onset of their cycle. That's when the breasts are supple and you'll be able to notice any changes. Now, pregnant women can also examine on the same day every month. So, first step is breast self-awareness or examination. Number two, clinical breast examination once a year after the age of 20. The third most important screening tool or early detection tool for breast cancer is mammography. So please ask for a mammography if you are above the age of 40 years. You may get it done once every year or once every 2 years. Mammography is nothing but an X-ray of your breast which can pick up an early lesion even before you feel for any lump in your breast. The third important cancers in women is ovarian cancer. Now, if you look at how do we prevent ovarian cancer, the best way is to know your family history. Check if your family members have hereditary breast or ovarian cancer syndrome. If they do have, you need to start screening about 10 years before the onset of the disease in a family member. So, one of the commonest way is to be vigilant about some symptoms. For example, bloating in the abdomen, vague pain in the abdomen. You need to reach out to your doctor, get your pelvic examination done, get an ultrasound done. Periodic examination at least once a year goes a long way in detecting the ovarian cancer early, because as I mentioned before, most of the times ovarian cancer is detected in later stages because to begin with there are no symptoms at all. That's why any unusual vague symptoms should not be ignored, especially if you have a family history of ovarian cancer or a breast cancer. So how can we prevent it? Healthy lifestyle again, reducing your body weight, maintaining ideal body mass index, being physically active is the simplest and a good tool even to reduce the risk of ovarian cancer. Now, moving on to the cervical cancer. Cervical cancer, as you all know, is the second most common cancer in women, especially in the low and middle income countries. India contributes to about 25% of the global burden of cervical cancer. Now, how can we prevent cervical cancer? Well, if you know the etiology or the cause of cervical cancer, it is by a simple infection called human papilloma virus infection. HPV infection is the root cause. So how can we prevent? Again, the risk factors like smoking and practicing unhealthy sexual practices, and of course having a poor hygiene. The genital hygiene is very important and risk factor. And if you can avoid this, the risk can be reduced significantly. So how can we screen, how can we detect cervical cancer very early? The one tool or one simple, the diagnostic test or the screening test for that matter, because this is done when you don't have any symptoms, is to do a simple pap smear test if you are above the age of 21. Once every 3 years. And if you do a HPV testing, you can do once every 5 years. After the age of 40, do an annual pap smear. That will help you to detect cervical cancer very, very early. So human papilloma virus, there are two types, the high risk virus and the low risk virus. The high risk virus leads to the cervical dysplasia, which also leads to finally to cervical cancer. The low risk viruses leads usually to genital warts or any other warts in the other parts of the body. So now the vaccines that are available, you may be wondering what vaccines are available, who should take them? As I mentioned, 9 to 14 years of age, and the vaccines, you have a bivalent vaccine, you have a quadrivalent vaccine, or you have a nanovalent vaccine. What does it mean? Bivalent means it is active against 2 variants of HPV. Now, quadrivalent is active against 4 variants, 6, 11, 16 and 18. Whereas nanovalent is active against 9 types, the most common 9 types of HPV infection, which leads to cervical cancer. Who should take this cervical cancer vaccine? The HPV vaccine has to be administered for adolescent girls between the age of 9 to 14 years. You can take simple 2-dose regimen if you are taking this vaccine before 14 years of age. The time interval between the 2 doses is 6 to 12 months. A simple 2-dose vaccine for adolescent girls has a fair chance of eliminating cervical cancer in our lifetime. We can save thousands of lives or millions of lives by a simple vaccination tool. So HPV vaccination is recommended highly especially for girls. Even in the Western world, boys are vaccinated because some of the oral cancers, warts, can be prevented by the infection of HPV. The dosing schedule for the girls who are taking vaccination between the age of 15 to 26 is 3, and the schedule is as follows: 0, 1 to 2 and 6 months. So with these 3 intervals, you will be able to have maximum protection against this HPV infection. For those who are immunocompromised and those who have got the weak immunity in their body, especially those who are taking any medications and on therapies for various other non-communicable diseases, can also take 3 doses, and that will be very, very protective. So those who are allergic to yeast, allergic reaction to any of the previous injectables, are a contraindication for this vaccination. And those who have got acute viral infection or fevers should not be taking this vaccine. But one thing, let me tell you, it is very safe across all age groups. Pregnancy in general is a contraindication for any vaccination, so that must be kept in mind. In our lifetime, we have an opportunity to prevent the second most common cancer in this part of the world. A preventable cancer is not prevented. There is a real opportunity for us to tackle this disease simply by taking a vaccine. A vaccine can prevent a cancer. Have you heard about this? Please convey this message, especially if you have adolescent girls. May I encourage you to consider this vaccination. So whichever you might take, the message that I want to leave with you today is that even a single dose of HPV vaccine can prevent this disease and eliminate this disease in our lifetime. So I request every parent who is watching this video to pass on this message to as many people as you know, so that we can really make a difference in saving lives. So now the simplest tips that I want to leave with all of you who are watching this video is that you need to look at your lifestyle. Lack of physical activities, which I've been mentioning time and again. So be physically active, avoid tobacco, avoid alcohol, eat healthy, because you are what you eat. That's why we need to focus on what we eat. Drink lots of water. Good hydration helps you to have to reduce the risk of cancer. Consume lots of fruits and vegetables wherein the antioxidants are there, which can actually protect you or fight you, against this disease of cancer. At the same time, the most important message I want to leave with you is, in spite of all this, you need to look at screening for early detection. So annual screening, annual health checkups, based upon your age and the risk profile, is important even before you have any symptoms, to detect these malignancies very, very early. So the call to action to each one of you is to stay healthy, stay fit, and prevent cancer. Screen to detect it early if it means to conquer cancer. Let me conclude with a statement: women's cancers are not death sentence if detected early. Awareness, right lifestyle choices, and screening for early detection can save countless lives. Together we can make a difference. I request each one of you to pass on this information to as many as possible, so that we can make an aware and a conscious community to fight against these cancers. Thank you so much for watching this video.